Good morning, guys. We're all sparkly. Just a quick one before I take the dogs for a walk. As you can see, Maddie is ready. We get lots of inquiries from patients wishing to transfer over to TMHC because their clinic does not subscribe to microdosing. Daily testosterone, cypionate and HCG injections to mimic natural physiology, which should be the purpose of TRT. You don't need to. You need to up the dose. No. If you're not feeling well, what should you do? You should obviously look to adjust your protocol to make sure your levels are optimal. And that should be done under the guidance of your prescribing clinician, not the forums. You should be looking to optimize your lifestyle, reduce stress, improve sleep, look to your nutrition, and look to exercise. What else should you be doing? Lots of things, but they're not for me to tell you. It's about perspective, having the right perspective. As I've said numerous times before, glass half empty, glass half full. With normal testosterone, you have the ability to choose glass half empty or glass half full. But testosterone should give you the emphasis, capacity, willingness to choose glass half full, because we want to be positive. We want to be motivated. We want to have self-confidence, drive, determination, all those things that you lacked with low testosterone. Now, all those negative attributes, were they because you had low testosterone? Was it cause or was it effect? Now, obviously, it's a little bit complicated. So what should you concentrate on? Ad nauseum. So, what's wrong with daily microdosing? Nothing. It's the best way of achieving stable male androgen levels. If you understand pharmacokinetics, you will say, well, you don't really need to inject daily to achieve stable levels. You can achieve stable levels with less intensive injection protocols. You could do Monday, Wednesday, and Friday, because physiology likes to take the weekend off, doesn't it, guys? You won't notice the difference. Well, your physiology will, because much like blood pressure, you don't feel blood pressure until it bites you in the arse. The complications of chronically raised blood pressure include heart attacks, strokes, clots, cardiovascular problems. So, should we apply the same rationale to testosterone replacement therapy? Well, yes. We don't need to be quite so dramatic, but if consciousness is the subjective appreciation of change, daily microdosing makes sense. As you guys already know, your male androgen levels follow a diurnal pattern. Anabolic processes predominate at nighttime. Catabolic processes predominate in the daytime. Your hormones don't care if it's Monday and you've got a busy day at work, or it's Saturday and you're going to hit the gym or chill, Netflix and chill, whatever you want to do. Your hormones want to be used how your physiology wants them to be used. And that's what you have, that spike of testosterone after you've repaired from the previous day to prepare for the day, with your spike of cortisol to do what? Be active. To go achieve your reward, which is food and then hopefully a bit of nookie. Rinse and repeat. So as you know, daily microdosing is the most effective way of that, because you will achieve stable levels with a less intensive injection protocol if you have a normal SHBG. But what we're trying to achieve is a peak and a trough that mimics physiology. By the very nature of injecting in the morning, you will cause a peak. That attempts to mimic your natural physiology. Now, if you've got low SHBG, you really do need to inject on a daily basis to achieve stability, because that testosterone just gets metabolized and peed out. What we want to do is achieve healthy hormone levels day in, day out. So can you be too stable? Well, yes, you can actually. Some of my low SHBG guys actually weekly microdose testosterone undecanoate, Libido, to achieve stable levels. And they actually feel better doing this than they do with daily subcutaneous testosterone cypionate injections. And this is because they've got low SHBG. Now, this sounds great, a weekly injection. But, disappointingly, outside of the arduous titration process and loading phase that we have to go through in order to achieve stable levels, and then adjust the protocol months later, and then months later, and then months later, they are too stable. And they don't feel the highs and the lows that we're desperately seeking, because consciousness is what? So these guys actually do need HCG. They do need that little peak and that trough. Felix has done a video on libido, and he talks about the complexities of libido. And it's not, disappointingly, just about testosterone. Oh, if only. Bang up the dose, or just carefully titrate the dose, and you will have a raging libido and a strong like bull erection whenever you need it. Obviously, it's incredibly complicated, and it involves numerous parts of the brain. Your psychology plays a major role, and your physiology, yes, your physiology plays a massive role. Something that Felix didn't go into in great detail, because I bang on about it all the time, is stress. Now go back to hunter-gatherer days, as I like to do. When you're hunting and you're gathering and you're activating the sympathetic nervous system, are you supposed to be horny, goat boy? Now the answer to that question is clearly no. What happens if that saber-toothed tiger comes creeping up behind you and you're admiring Raquel Welch's bottom in her leather-clad bikini? You're a goner. And what's life all about? Survival. That wonderful seesaw effect between your neurotransmitters, the stimulatory neurotransmitters and cortisol, and your calming hormones, testosterone, DHT, and estradiol. Noting that it's more complicated than that, because everything is more complicated. And testosterone can positively impact the amygdala and the decision-making risk decisions. Ah, yes, it's more complicated than just simply a seesaw. Now, your body is desperately seeking balance. It's desperately seeking stability. Is it? Yes, it is. It's desperately seeking the ability, and I'm talking about ability to adapt to the external environment. Now, if you take away the ability for it to adapt, aka too stable, then you are not looking to optimize physiology. What we want to do is have a healthy testosterone level to allow change. What we want to do is understand pharmacokinetics and understand biology, and realize that the most effective way of doing that is daily microdosing of testosterone, cypionate, and HCG. Now, what happens if you do feel too stable? Well, some of my guys actually daily microdose intramuscularly versus subcutaneously. And we prefer subcutaneously because it's less painful and there's less aromatization of testosterone to estrogen. But these guys do not care. They feel the benefits of intramuscular injections compared to sub-Q, and it's just a little prick. So don't worry about it. A small minority of guys don't get on with HCG. They get excess neurostimulation from the HCG, because as we know, HCG will produce intratesticular testosterone and optimize the pathways, the natural pathways within your body. And it'll also stimulate the neuroendocrine systems to hopefully give you an improved sense of well-being and libido. But as we've said before, it's a little bit more complicated than that. And there are other endogenous and exogenous factors that will impact your sense of well-being outside of trying to mimic natural physiology. So some of these guys actually don't get on with HCG and they get excess neurostimulation. Now, what you've done before, what you're going to do now, and what you're going to do in the future is going to impact your physiology. So look after yourselves, keep it simple, keep it safe. Daily microdosing is the best way of achieving stable male androgen levels. I'm going to go and earn my reward.